There is a renewed push at the federal level to change a rule impacting health care in Missouri and in Kansas. This rule specifically impacts how much new parents pay for their child's health care immediately following birth.
KSHB 41 is a voice for everyone, so we're turning the mic over to a family who doesn't want anyone else to endure what they did. Reporter Charlie Keegan has their story.
The American dream is clear as day. Own a home, get married, have kids.
This is the first time she kind of opened her eyes.
But 4 years ago, things were a little less clear for Mikkel Chelsis.
And this is kind of the first time we could kind of hold her.
When his daughter Charlie was born, Daddy's little girl needed extra medical attention.
That first night was extremely tough. That first week was extremely tough. So we just grind through it.
Doctors transferred Charlie to a different hospital.
Not optimal.
With a specialized NICU.
At that point, you don't think about healthcare cost or, insurance, backing and things like that. You just essentially want a healthy kid.
Several months later, once Charlie was home and healthy, those healthcare bills started piling up. The total of $270,000 caused more confusion. Shouldn't insurance have paid this?
You're going through the stress of coming home with a baby, then an added stress of the bill.
Mikkel and his wife Kayla had separate health insurance plans. Kayla's was great. It covered almost everything. Mikkel's had a huge deductible and required lots of out-of-pocket spending. So the family wanted Kayla's plan to cover Charlie's care. But a rule called coordination of benefits, or the birthday rule, comes into play for the first 30 days of a child's life. It automatically assigns a child to the insurance plan of the parent whose birthday comes first in the calendar year. Kayla's birthday is December 31st, so the rule automatically applied Mikkel's insurance to Charlie. If Kayla's birthday was 1 day later, on January 1st, her insurance would have covered the baby.
We have healthcare, we have jobs, we pay for it. And then there was just an essentially eternal bickering between healthcare providers.
Explaining why the rule exists is even confusing. Proponents say the rule creates uniformity and efficiency. U.S. Representative Sharice Davids calls it random.
My bill aims to fix the arbitrary nature of the birthday rule being used to select which insurance plan covers the child.
She's reintroducing a bill to put the power of choice and clarity in the hands of parents.
Bringing your new family member home should be an occasion of joy and excitement.
I'm hopeful something will happen.
Joy fills the Chelsis household these days. After more than a year of back and forth, the insurance companies work together to ultimately pay Charlie's medical bills.
To this day, I really don't quite understand, but we're just glad it was resolved.
Mikkel hopes Davids and Congress make the rule more clear for future parents. In Olathe, Charlie Keegan, KSHB 41 News.